Today I will teach you CPR for a child above 1 year of age, and similar principles can be applied to adults also for CPR. So if you see a child who is not responding or suddenly a child collapses in front of you, first thing you have to make sure that the child is actually unconscious. Approach the child, tap the child or tap the leg. How are you? Are you okay? Just ask something to the child. If there is no response, you feel there is no breathing, then you check for the pulse. We check for the carotid artery in children above 1 year and in adults. So this central part of the neck, place your hand here and then you gently go this side. You'll feel a ridge. As soon as you feel a ridge or a resistance, that is the area where you can feel the carotid artery. Please check it on yourselves so that in an emergency you know exactly where to feel it. So you put your fingers here. If in 10 seconds you don't feel any movement, that means that the child is in need of CPR. So what you do in that case, firstly, if you are alone, immediately take out your phone. These days all phones have speakers, put it on speaker and dial someone and tell them to call for help, to get an ambulance, and also call somebody at the scene to help you out. So first things you have to do is start chest compressions. So how do you start chest compressions? On the chest of the child, first you make sure that the child is lying on a hard surface, not on a bed or on grass, either on a table like this, or you can make the child lie down on the floor also. Then on the chest you identify the nipples, pull up the child's shirt, identify the nipples. Below the nipples, just below the nipples, you place the heel of your hand like this on the central bony part which is known as the sternum. On top of it, you place your other hand like this, and you place them like this, and then you straighten your elbows. Your elbows should not be like this. You straighten your elbows and you push down so that at least 2 inches or around 1/3 of the chest should be pushed down. So it has to be done with force. And you do this 30 times, 30 times. And when you press like this, you have to press. And the chest has to come back. If you are pressing like this and the chest is not coming back, this is not going to be effective. So you press so that the chest recoils and comes back to the original position. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. After you have done chest compressions 30 times, you come this side. If it is not a case of head injury, the child has not become unconscious because of trauma, you put your fingers here below the chin and your hand on the forehead, and you gently tilt the child's head up so that it will be easier for you to give the child a breath. Then, holding it like this, you press the child's nose and you breathe into the mouth. 1 time, 2 times, and then you again go back to doing chest compression. Again same place like this, 30:2. So 30 times chest compressions, 2 breaths you have to give. In case somebody comes for help, then in children, one person will stand on this side to give the breaths and one person will give chest compressions 15 times. So 15 chest compressions and 2 breaths if you have another person to help you. If you are alone, just 30 times chest compressions and 2 times breathing. If you find that a child is unconscious but you feel a pulse but you don't see a breathing, in that case you don't have to do chest compressions. You just have to keep giving breath into the child's mouth every 2 to 3 seconds. So this is how you do CPR.